Hello, my name is Rich Lara. I am an educator and clinical coordinator with the Yuba College Radiologic Technology program. If you're watching this video today, it's because you're interested in a career in healthcare, and specifically a career as a radiologic technologist. Congratulations, you made a good career choice. My purpose is to try and teach you what it's like as a radiologic technologist. What is the career all about? What is the job all about? I'd like to give you a factual representation of radiologic technology as opposed to what you might have seen on TV. Let's talk about what is a radiologic technologist. Perhaps you've heard the term X-ray tech, and in fact, that's what we're talking about. Radiologic technologists are individuals who are medical photographers who take pictures of the human body. Often those pictures are using radiation to demonstrate the bones and the structures inside the body, but there are also other modalities that also demonstrate the body in different ways. You can get this kind of training, this kind of education through a variety of different sources. Yuba College offers a program in radiologic technology, and that's considered the entry-level position for diagnostic imaging in the hospital. There are other ways that you can get this same type of training, and that includes educational programs through hospitals, which are not necessarily designed to offer a college degree, but they would offer you a certificate of completion. Where can you apply this training? There are jobs available for radiologic technologists in hospitals, in physicians' offices, clinics, surgical centers, anywhere where there is a need for imaging the human body as a part of medical procedures. That is where they need radiologic technologists. Now, I mentioned that there are different imaging modalities, and I want to talk just very briefly about what those imaging modalities are. Yuba College, our radiologic technology program, is primarily concerned with offering the education that you need to become a radiologic technologist. And this image up here, this is an X-ray. X-ray uses radiation. Radiation has the ability to penetrate through the body. As a result, we can take a picture of the inside of the body, as opposed to if we were just using light, we would take a picture of the outside of the body. Here in the center is another imaging modality. This is nuclear medicine. Nuclear medicine uses radiopharmaceuticals, weakly radioactive substances that go through your bloodstream and then collect in certain tissues of the body. Next to it is magnetic resonance imaging. MRI is another imaging modality that uses radio waves in a magnetic field. And finally, on the bottom is an ultrasound image. Sound waves into the body, and they bounce around on the structures and then are reflected back, and these are collected, and the software makes a picture. Now, what you're seeing on these four imaging modalities are essentially the same anatomy, but you see it in four different ways. That's because not any one imaging modality is the best in all situations. So these are the four different imaging modalities, and of these four different imaging modalities, Yuba College offers a program of education for one of them, and that is radiologic technology. So what's it really like as a radiologic technologist? Well, I have a short video that I'd like to show you, and on this video we're going to bring a patient into an X-ray room, and we're going to take X-ray images of her foot. And then after the video, we'll come back and we'll talk about it a little more. That was an actual radiographic procedure. That was an actual exam, 3 projections of a foot on a patient in the hospital. In the X-ray room, we first identified to be sure that it really was the correct patient. We asked her some preliminary questions about what happened, the mechanism of injury, women of childbearing age, whether or not there's any possibility of pregnancy. And then I went ahead and used that lead shield to put over her abdomen and pelvis because we are acutely concerned with radiation protection, not only for ourselves in the profession, but also for our patients. What were those 3 projections? Well, the first one that we did was this AP foot, anterior posterior foot. The central ray, as you remember, entered at the base of the third metatarsal, right here where the crosshairs are, and the resultant image shows a foot, all 5 of the digits, all 5 of the toes, and the metatarsals. Here's the base of the third metatarsal, which is where the central ray was entering, and you can also see a portion of the tarsal bones just below the ankle. See these joint spaces? You can see these joint spaces very clearly. This is the metatarsal, this is the phalanx, so this is the metatarsal phalangeal joint. That's why we angled the X-ray tube, because your foot, the top incline of your foot, is 10 or 15 degrees. So by angling the X-ray tube, we're able to better see these joints. Then we went to the medial oblique projection. Remember, I had Natalie oblique her foot over 45 degrees, and here it was. Again, the central ray enters at the base of the third metatarsal. But look at how differently we can see the X-ray image now. Look at how different the bones look. Not only can we see the metatarsals and the phalanx, but we can also now more clearly see these tarsal bones, as well as now we're getting a projection of the calcaneus. Previously on the AP foot, we weren't seeing the calcaneus at all. Remember I said that for structures that have a lot of joints, we need 3 projections. So this medial oblique demonstrates for us some anatomy that we weren't able to see in the AP projection. And finally, the lateral projection is going to show us the foot in yet 90 degrees opposed from our AP projection. And on the lateral projection, now we can clearly see the calcaneus and the talus and the tarsal bones, as well as the metatarsals and other structures that weren't showing up clearly on our AP or our medial oblique projection. So this is what it is that X-ray technologists do. We image the human body. We don't do it indiscriminately. We always have a request. We always have an order from the physician who has determined that this is the best imaging study to demonstrate what they suspect is the problem. In bony involvement, it's X-ray. With other types of involvement, belly aches, cancerous processes, et cetera, we could, perhaps one of those other imaging modalities would be better suited. And there are technologists who work in all of those areas also. In X-ray school, we're going to take you through the entire body. We're going to show you all of the individual bones in the human skeleton and systems that lend themselves to imaging with radiography. For instance, this is an AP leg. This is a tibia fibula, the space between your knee and your ankle. And in X-ray school, we're going to teach you that you're going to take a 14 by 17, that's a standard size, image receptor. It's no longer an X-ray film, it's an image receptor. And we're going to place it diagonally so that we can get the most length. We're going to collimate the useful X-ray beam. That means make it only as wide as we really need it. The central ray is going to enter at the center of the tibia fibula. We're going to put a marker. We're going to rotate the knee just a little bit so that the plane of the tibial condyles is parallel to the plane of the image receptor. This is the extent that we are going to teach you. This is the textbook. This is the best way. This is the standard for imaging the tib fib. And then you're going to take this practical knowledge into the hospital, where you'll be able to put it into use for hospital patients. Take a look at this leg. This is another tibia fibula. You detect that this is not a normal looking leg, because you can see that the knee is pointing straight up and the foot is turned toward the other. It's turned the wrong way. Would you say that this is fractured? I think that it's very likely that this is fractured, but I'm a radiologic technologist and I cannot interpret the X-ray images because that would be practicing medicine. My job is to get the best images of this injury so the doctor can make the correct diagnosis. And so here is my image. Is that what you expected to see? There's not one fracture, but there are 3 here in the proximal and the distal portion of the tibia, as well as an associated fracture here in the proximal fibula. This is before and this is after. One of the ways that we can fix this in the healthcare industry is that we will take up in the operating room and put a long, what we call intermedullary rod through the intermedullary canal of the bone, and then we affix it with screws up here and screws down here, and so suddenly this rod now takes up the weight from this patient and takes this broken segment out of the equation. Do you think as a radiologic technologist you will be participating in the operating room? And the answer is yes. Radiologic technologists are considered an integral part of the healthcare team. There's other ways that we can image the body. It's not all about bones. We can use contrast media to demonstrate structures that might otherwise not show up. In this case, we've used barium sulfate, and barium sulfate will show up the gastrointestinal tract. You might recognize the stomach up here. You might recognize the small intestine, and you might recognize the large intestine. So the barium studies are also something that we do with regularity in radiologic technology. You might have heard of CT scanners. CT is considered a promotional opportunity. It's not an entry-level position, but as a radiologic technologist, you would be in a position where you could aspire to become a CT technologist. And CT technology is no longer all about X-ray films, but now we have images that show up on our computer screens, and doctor can scroll back and forth and up and down through the anatomy in order to make their diagnosis. Another use for CT scan is when we have findings on our X-ray film or our X-ray image and we need to demonstrate it another way. Here's a young woman who came in and she had neck pain, perhaps from a motor vehicle accident. All right, so I would radiograph her cervical spine, but I can't see very clearly. I can see vertebral level 2, 3, 4, 5, 6, 7, but I'm not seeing the interrelationship between C7 and T1. So I do a different projection called a swimmer's projection, one arm up and one arm down, and by doing that, I'm able to demonstrate vertebral level 5, 6, 7, and there should be another vertebrae here, but it's in back. It's out of place. So an example of CT scan is that we would take that CT scan of that small area and reconstruct that data. Here's a pelvis. Does pelvis look okay? Well, here on the right side, this looks pretty normal. The pelvic inlet is intact. Here's the acetabulum, head of the femur, femoral neck, greater and lesser trochanter, proximal femur. But look over here. The head of the femur has come all the way through the pelvis in this case. Again, I could go to CT scan, I could build a model of this, and then I could move it around to demonstrate the extent of the injury much more clearly. So these are some of the things that we can do in radiography, but it all starts as an X-ray technologist. A career as a radiologic technologist can lead to many promotional opportunities. There are some technologists who specialize in mammography. There are some who spend a vast majority of their career or their entire career up in the operating room doing surgical radiography. There's also promotional opportunities for interventional radiography, for CT scanning, for MRI scanning, or you could choose to go back to school. So in conclusion, if you were involved in a serious injury, or if someone who's close to you is involved in a serious injury, they're going to take you to the hospital. And you have an expectation that those people who are taking care of you in the hospital know what they're doing. If this looks exciting to you, if you're an adrenaline junkie and you like the opportunity or the challenge of not knowing what's waiting for you around the next corner, or perhaps if you like the idea of working with the latest and the greatest cutting-edge technology, because we have some really neat stuff in the hospital industry, or perhaps you've known for your entire life that you're going to have a career in the healthcare industry, Yuba College would like to help you get there. In addition to radiologic technology, we also offer programs in nursing, in veterinary tech, psychiatric tech, and there's a police academy and a fire academy here on campus as well. So you have a lot of choices open to you. I know that you're interested in a career in radiologic technology or other. I hope that this brief video has helped you make that decision. Thank you for your attention, everyone. I hope to see you in class.